Welcome to Insurance Now, a podcast devoted to helping busy insurance agents stay up to date on our rapidly changing industry. With your host, Rebecca Gordon, crazy mother of four, second-generation co-owner of Gordon Marketing, one of the nation's largest FMO IMO offices. Rebecca has trained over 2,000 agents in her career and is an expert at helping agents grow their business. Rebecca Gordon, Insurance Now.
Insurance Now with Rebecca Gordon. I'm your host, Rebecca Gordon. Hope you guys are doing great. And we've got an awesome show today. We have Kelly Rayburn with Medico.
Hello.
Hello, Kelly.
Hello, Rebecca.
Hello, Clarice. The first person who can send me a comment and tell me what movie that is from, I will send you a $1 lottery ticket. I will repeat. Hello, Clarice. My husband and I love stupid, I don't know if you call that trivia or not, but we love to recite stupid sayings from movies. Especially Tommy Boy, Step Brothers, Wedding Crashers. I hate to admit it. I always want people to think I'm super smart. No. This is full of nonsense. But we have a great show because this interesting market of ours called the insurance market. I gotta tell you, what I love the most about the insurance market is this. The carriers are smart and they have longevity, the smart ones, because they constantly are inventing products to stay relevant in the market, right?
Yes.
So you guys are interesting because you have been, and I might be wrong, more of a senior carrier with MedSups, and you're DVH. But you have a new product that is targeting those young 40-year-old whippersnappers, which is my group, and creating a product that then bridges them to the Medicare market. And I'm seeing more carriers do this. More carriers create products kind of enticing that under 65 agent, especially that agent who has yet to still enter the senior market. Like, they still think something's going to happen and we're going to go back to underwriting with health insurance and 25% commission. Dear Lord, sweet baby Jesus, 7 pounds, 12 ounces. That would be awesome if that would happen, but we know that's not going to happen. So I'm seeing you guys and some other ones starting to create these plans that is going to get the attention of the under 65 person and then push them ever so gently into the senior market in which you still have senior products. So I find it brilliant.
Yeah, I think a lot of the carriers too, not only with pushing it into the senior market, I think something that's extremely important to remember is this particular product we're going to talk about, the hospital indemnity product, is really designed to help agents that are in other marketplaces than senior, so that whenever they get to a senior market or whenever they have clients that get to that senior level, this product continues to carry over. And it has a level premium, which is nice. So once you once you start paying your premium, the premiums are never going up. But just to touch on those other markets, I think some of the other markets that people are forgetting that carriers like Medico can sell into are people that have ACA, they're in the ACA, and also business owners. People that might not even have insurance for one reason or another. Maybe they're self-insured.
Maybe they can't afford it.
Yes, they can't afford it most of the time.
Because it's astronomically expensive.
It is.
You could either pay your insurance premium with ACA or have a second house in Vail. I don't know.
I think I would probably elect for the second house.
I'd go for Vail.
Yeah, I would too.
So let's just quickly, because I know, you work for the carrier, and I sure don't want Dave Peters or anyone listening to this and then saying, Kelly, why didn't you talk about Medico? So just give us a really quick, because I want to get to the meat and the potatoes of this plan. And if you guys are listening right now, when you get back to your house or wherever you are, when you get off the treadmill, I want you to go back and re-listen and write down these high points that we'll eventually get to, because this is a great product. I'm super jazzed up about it. But before we get to there, tell us just a smidge about who Medico is and why we love them.
Okay. Well, Medico is actually a health insurance carrier, as you know. We're a mid-level mutual company. We've been around since the 1930s, so we're not new to the marketplace. The one thing that sets us apart, I would say, well, actually, I would tell you that two things really set us apart. One, our customer service. Any of our agents that have ever called into the customer service line, or what we call agent services, knows that we are extremely knowledgeable on that desk for anything that is Medico. Something else that sets us apart is our technology. You will hear over and over, if you talk to the agents out in the market that write with Medico, that our MyEnroller e-application process is extremely simple, easy to use. Not only can you use it with Wi-Fi, but you can use it without Wi-Fi. So I think that's very important for to know about
we
Medico.
get asked this all the time. You go out, you're in the country. Mm-hmm. They don't have Wi-Fi. They don't know their password. Mm-hmm. I sure as the heck don't know my password at home.
Right, I don't either.
So they can put it in their iPad. It saves. They go back to where there is Wi-Fi, and it just is done.
Correct. All they have to do is log back onto the MyEnroller. Automatically sends it electronically to our underwriting department.
So, guys, this is one thing I want you to keep in mind. We're going to start doing weekly training webinars on MyEnroller and how easy it is. So what I want you to do is in your comments, if you would please respond back that you want information or to be on that distribution list. So when we send out that invitation for those webinars, you get that link. So all you have to do is in the comment box is just say, hey, Rebecca, I want to attend the webinar. Or you could just say webinar and I'll know what that is. Yeah. So that's cool. Okay, so we like Medico. We've had a long relationship with you guys. You've always done the right thing. I always tell agents, you can go get any FMO. There's other FMOs. I dare say there's many that are as fun as we are, but I'm a little bent that way. But anyone can go onto Google and get all the information. Mm-hmm. It's everywhere. But what really makes an FMO shine or prove their value is when that agent has a situation with their client who's been their client for 20 years. They go to the same church. They have their life policies, a whole bunch. And that client is mad. And the client goes to the agent calls us, and they expect us to be able to get to the carrier and the carrier to honor their contract. Mm-hmm. And that is why, if I had a horn, and actually I do, I'll find it on my phone here. You guys you've always done that. So I don't give out compliments easily to my different carriers. If they do a great job, I give out good compliments. That's not true. But it takes a lot to impress me, and that's the most important thing I look for from a carrier. So I'm going to give out a... That's what I'm talking about. That's what I'm talking about. See, Kelly, I have all these sounds right here that I shouldn't even be allowed to do this job. I should not have all these toys.
That's pretty fabulous.
Okay, so we're going to talk about the hospital indemnity plan.
Yes.
So Kelly and I were talking about before the show started, because I don't like the word hospital indemnity. I'm a big believer in words. And if people don't understand words fairly quick, they're gonna nix you out, right? They're gonna just tune out. It's like white noise. So when we were at our Rising Star, Kelly came with us as a sponsor, our Rising Star trip. We were just down in fantastic New Orleans, 4 days, 3 nights. Super easy to win, folks. If you want to be one of our Rising Stars to go next year, we go in January. It's for new producers. I can tell you how to get there with Medico and this product. Just put that in the comments. But an agent came up to me and said, you know what, I really feel like we need to, he loved the plan. He was huge in the under 65 market. Mm-hmm. And totally saw how this will be a great door opener to the senior market, as well as helping all of his self-employed. But just finding a catchier name, maybe a more... So I was asking Kelly if I could call this like a hospital debit card. And Kelly said...
No.
Kelly said no. She said I could get in trouble. But this is really what this product does. If you go to the hospital, it pays.
or if you go under observation, it pays. I'd like to look at it more as maybe more the premiums are paying for a line of credit. Let's maybe look at it that way. So let's say, for instance, Rebecca, that you have an agent that sold this hospital indemnity plan to a client. And the client goes to the hospital. Let's say they filled out $200 a day for a 6-day hospital stay. That particular client goes to the hospital. They get out of the hospital. They file a claim to Medico. And let's say they were in the hospital for 3 days. That claim gets filed. Medico pays them a check for $600. The check goes directly to the client to be able to help reimburse any costs that the hospital stay would have had. That reimbursement could be a car payment, it could be insurance, it could be for a drug that they're now using. It actually could help pay the bill that they've accrued at the hospital. It depends on what the client wants the money for.
If they have a $1,000, who are we kidding? A $5,000 deductible, it's going to the deductible.
Yes, likely.
How many clients do you think you have who, A, just buy this product only? So there's no penalty in the under 65 market anymore. We all know that this open enrollment was very low. In fact, statistics show that more people drop their under 65 health insurance than ever before, mainly because people have no clue what to do. It's expensive. Half of the counties in this country do not have an ACA plan. So most carriers don't offer anything. Commissions are cut. I mean, it's gloomy and dark and yucky. So, but this people can buy. There's no penalty. Do you have any idea how many people are just buying this?
We saw 146% increase in this particular plan from 2017 to 2018. So almost 150% increase in applications, and also we have an over 90% approval rate for this particular product.
Any idea what your age sweet spot? Who's buying this?
Anybody really between the age of 55 and 70.
55, so that's your sweet spot, 55 and 70.
Yep.
All right. So tell me a little bit how this plan, so A, you could do this plan. I always like to know the marketability of a plan. So from my standpoint, we run a marketing company here, and my goal is to look for products where I can get agents to engage, to call, to want to know more about it. Agents want to have products that their clients will call, will engage. So the marketability of this product is, it seems to me, A, you said the ages to buy this plan are 40 to
85.
85. So you've got young whippersnappers to the wise.
Experienced.
Yes. I could say wise.
Wise is good.
That would not offend my dad.
It could offend the 30-year-old.
Oh, yeah, you're right. Well, you know what? Too bad. I don't think they have enough experience. That's a shout out to my nephew who's in the insurance business, who's 26. He'll probably send me a comment. So we could do it as a standalone. So how many health questions are, so if I'm just going to do this as a standalone, I talk to somebody, they have nothing, they know they need something. What about the health questions?
So the health questions is a simplified application. So the health questions, there's 9 knockout questions. One of them is going to be taken off of the table for half of the people that are likely going to take the application, because the question is, are you pregnant? You have the HIV question, you have mental health question, you have cancer, heart, stroke question. That does not knock you out. It's just simply we need more information. We have the diabetes question. That does not knock you out completely. It depends on what the A1C levels are of the client and how they are managing their diabetes. Injectables is the knockout. So if there's an injectable insulin that's being used, that's not going to fly.
But diet control,
perhaps. Diet and exercise, A1C level below 7 is good.
Okay,
Yep.
That's cool.
So the normal simplified questions are going to be how this product is really underwritten. Of course, we look to our agents to do a lot of that underwriting, field underwriting for us. I think it's that we need to point out that it's really important that the agent is asking the questions and asking them appropriately. You don't want to see someone that's 7 months pregnant and apping this and asking the question, are you pregnant? And the client looks at him and goes, no. Because we do know that there are clients sometimes that do that to agents. It's unfortunate, but it happens. We do have a 6-month contestability and a 2-year look back. So if there is a question after a claim is filed, We will dive into the MIB and the script check and look at the coding on EOBs that are filed in the claims, just to make sure if we need to return the premium to the client because the validity of the product that's been put into place is in question, then we would do that. I will tell you this, out of the year 2018, there was only 2 claims that came under question that were filed.
Oh, that's awesome.
Mm-hmm.
So now let's say you want to package this, because I could see how this pays in addition to all their coverage. Is that correct?
Correct. Mm-hmm.
So you could package this with a short term. You could package this with an ACA. You could have it as a standalone. You could do whatever you want.
Correct.
Let's talk about the Medicare Advantage market, because the very first thing that's listed on your benefit comparison, and folks, if you want to get the copy of the benefit comparison, in the comment box, just write that, benefit comparison, and give me your email. I always forget to say, I need your email. That way we'll send that to you. But I noticed right off the bat it says daily hospital confinement benefit. So whenever I see these words, I automatically think of the Advantage market, because those like days 1 through 5 is on the hook for the client.
Right.
And that's what you got to look at with new Med Advantage plans. What's that daily copay? That, or whatever you want to call it. So here, you can choose from $100 to $600 a day.
That's correct.
And so go ahead and explain this, because this is where I see a lot of people potentially writing this for a client, like you said, 55, and then once they reach Medicare and they're a good fit for an Advantage, keeping it and offsetting that hospital confinement copay deductible that they have. So take it. What do you think?
So typically in the Med Advantage market, the days 1 through 5 are not covered. That's considered out of pocket for the client. So if they get admitted into the hospital, they could be out of pocket roughly around $1,800 for a 6-day stay. And really the average stay for the hospital right now is about 5.5 days. Okay. So what our plan does is it comes in and it will pay for that very first day. So let's say client goes into the hospital for 5 days and they have a $1,250 bill coming out of the hospital. If they have purchased our hospital indemnity plan and they purchased it for $250 a day for up to 6 days of coverage, that complete bill of that $1,250 that the client would be accruing or even taking out of their savings account, checking, having to take a distribution out of their retirement to be able to pay for their hospital stay, the HIP plan would come in and cover that cost. And again, when the client gets out of the hospital, they file the claim. The check goes to the client. It doesn't go directly to the bill, unless, of course, they assign that benefit.
Is this similar to GTL?
It is, actually. GTL is our closest competitor. So you were talking about the benefit comparison sheet. It says on that side of the sheet, the leading competitor benefit. That actually is GTL's program. GTL's program is very similar to ours. Ours has an enhanced benefit with the travel and lodging, the chiropractic care, which we're going to get to, I think, on when we talk about the riders. We also have a increased days for what a agent can customize it for a client. It's days 1 through 6, 7, 8, 9, 10, 21, and 31. A little bit different than what GTL's product would be.
So give me an example of that. If I was to customize all the way to day 21, what does that look like?
So let's say, for instance, an agent, actually, let's use 31, because that allowed us to get into Florida. For
Easy.
Any agents that are out there that may be working in Florida, this product with Medico is now available in your state.
Thank God.
Yeah, exactly.
I think that there are a couple seniors in Florida, I heard.
A small amount, especially during like 6 months out of the year. So let's say, for instance, you sell this for $100 a day for 31 days in Florida, because 31 days is the only amount that you can have in Florida. So a senior goes into the hospital. They're in the hospital for, let's say, 15 days. Okay. So you get out of the client gets out of the hospital. They would then file the claim to Medico and get that check back for $1,500. The 31 days, the reason why we added that 31 days is because the minimum amount in Florida that you would be able to be covered for if you were going into the hospital is $3,100. And in Florida, hospitals, they're expensive. They're expensive to go into, right?
Okay. So then let's say, talk about the restoration benefits.
Oh, yes, absolutely. Well, I also want to touch on our observation, because our observation, I think sometimes people get overlooked, or the medical market, to be honest with you, maybe even the agents don't really understand the observation. It's very important for a client to be covered under observation, because this could be something that is allergy related to a drug that they may be taking, or if they it could be allergic to poison ivy and they end up going to the hospital to be put under observation because they may be having trouble breathing, or they have a rash, or whatever the case may be. Our observation actually pays 100% of observation for no maximum amount of time. So a client can be under observation for 3 days, depending on what they may be in that room for, coded under observation. We're going to pay 100% back to the client once they file that claim. That, to me, is actually more important than, I would even say, almost the inpatient, because a lot of times hospitals are
they're putting everybody under observation. This is the biggest racket there is for seniors. I agree. This would be the number one reason to buy this plan. Mm-hmm. I mean, I am nervous. You know, you take somebody who something happens to them, they go into the hospital, and they're under observation. We hear this all the time. 7 days.
Yes.
And they start getting bills. And it's not a bill for like $100. It's a bill for $15,000.
Right.
$20,000. And then they complain, like, what the heck is going on? And they're like, well, you weren't admitted. You were under observation.
Mm-hmm. Yes.
I don't know how that is fair. So you're saying that you guys would cover the entire bill?
Yes. 100% observation, no minimum or maximum time.
That, folks, is the number one reason to sell this. Because that under observation, you take, like I said, somebody on a tight budget most people are on a tight budget. Mm-hmm. And I hate to use the word scam because I've said it enough on this podcast. I'm going to get in trouble by the insurance companies. But Medicare, this is a scam of this under observation crap, because this is the person getting squeezed and blindsided is the customer. And the client they have no negotiating power when they go in. Chances are something's happened to them, so the last thing they're going to be like is, no, wait, admit me, mm-hmm. You know?
Right.
It's going to be after the fact. That is...
Yep.
So this covers... So I'm going to say that again, because this is a big deal. And if you guys are listening to me and you don't have any idea why this is a big deal, you need to contact me. Because if you are in the senior market, and if you're not in the senior market, you should be, because it's only the most lucrative market in the insurance industry, because we have gobs and gobs of people.
Right.
That's the number one hiccup. I did not realize that. That 100%, and are you sure I'm saying this correctly?
So if someone goes under observation for a period of time, they are going to be paid back, if they file a claim, 100% of the cost of the observation. So let's say, for instance, my next door neighbor, she went into she actually went to urgent care first. She was having some issues with the leg. It was swelling. She's 52 years old. She went to the urgent care. The urgent care immediately sent her to the ER because they said it's the first sign of a blood clot. She goes to the ER. The ER does a test. They said, yes, it's a blood clot. Well, they didn't want to admit her into the hospital because a blood clot's not admittable. It's not something that you're usually admitted for unless it's in your lungs or it's something that they can't break down. So what happens is she gets put under observation. She was in the hospital, Rebecca, under observation for 3 full days. 3 full days under observation. Well, if she would have been admitted into the hospital, she would have had a completely different bill, right? So her being under observation, going in, filing a claim with Medico, we would have paid for those 3 days, that whole cost of her under observation.
You know what I like to call this benefit? Ka-ching! I'm going to do that again. Ka-ching! We're going to do that one more time. Ka-ching! Folks, I am telling you, this is the number one reason to sell this plan. Wow. Mm-hmm. That is positively amazing. Under observation. That is crazy. All right, let's talk about the next cool thing, the travel and lodging. I also love this.
Oh yeah, it's great. It's a great benefit to our base plan. So everything that we've been talking about, first of all, I just want to make sure that everybody understands and it's perfectly clear that all of the benefits so far that we've been talking about are all on the base plan.
Hold on. I have a sound for that. We quickly were in Africa for a second.
I was like, I don't understand the elephant, but hey, whatever sound
That'll
you
work.
want to do. So the travel and lodging is on the base benefit, and it allows the insured, if they need to travel longer or over 50 miles with one legal adult. So let's say, for instance, it's a husband and wife. The husband's going to drive the wife to get care past 50 miles. So any hospital, they could be a rural going into a city to get a hospital, or even if it needs to be a specialty. Okay, so it pays $100 a day for 10 calendar days per year, so up to $1,000 a year for travel and lodging to get the insured to the care that they need for whatever their specific
So
condition
it just helps take off some of that expense.
Exactly.
That's awesome.
And it's on the base benefit. No one else has that.
And that is built in.
That's built
Because that's what, chances are, if something happens to someone and they have the means, somewhat of the means, they're going to try to go someplace better.
Yes.
They're going to seek out the best that they can.
Mm-hmm. Yep.
So all you have to do is go 50 miles. You get $100 a day. It's not going to cover everything, but by God, it's going to help.
It'll help with hotel. It'll help with gas. It will help with food for the person that may be bringing the insured to and fro. So it helps.
It just helps.
Yeah, it just helps.
It just helps.
Yeah.
So again, anything related to the hospital,
The hospital stay of the insured.
this whole plan kicks in.
Yes.
It's a plan in case you go into the hospital.
Yes.
But I can't call it a hospital.
You can't
Debit
call
card.
it a debit card. We could call it a credit line. Your premiums
Have a
are
credit line.
paying for a credit line.
I'm curious what the agents think, what a good name would be. I'd like to know. You guys should send that to me. All right, so let's just recap real fast. We have 7 health questions.
9.
Doggoners. We have 9. 1 is, are you pregnant?
Right.
Nobody wants a pregnant person. Nobody wanted me when I was pregnant. I remember that. So 9 health questions is accept, reject, right?
Yes.
40 to 85. So you've got some play. You can go the young folks.
Yep.
You can go the old folks. You've got a lot of versatility.
And please know, too, just on a side note, that don't shy away from the older group. So the 80 to 85s. I had an agent at the end of 2018 that took an application for a hospital indemnity for an 84-year-old, and it was $18 a month for the base plan. It was affordable. It was based on his zip code.
Where the heck did they live? I would think of a place and make fun of it, but then it'll be a list, so
I don't.
I'm not going to do that.
I don't recall.
Alaska. They were from Nome, Alaska.
Well, we don't carry Alaska
Oh.
with hospital indemnity, so it wasn't there.
Wow. All right. Well, we're going to get into how you price this out here in a second.
Okay.
So what is the policy fee?
No policy fee. There's
Love it.
no policy fee.
No policy fee. What's the household discount?
Household discount is 7%. And the household discount is different than most other household discounts. 2 people do not need to be applying for this particular product to get a household discount. If you have one person applying for the hospital indemnity policy and there's one other person living in the household over the age of 18, the 7% household discount applies.
So I remember you saying when we were in New Orleans that the person just has to be living there at time of app. So you said like a college student
Correct.
who might be leaving for university in the fall, but I'm taking this out in July.
Right.
So boom, I'm getting my 7% household discount.
Right. And, between you, me, and the fence post, a college student, doesn't really live at college. Their home residence is really their house.
Some parents actually think they live there.
Most parents probably wish they
They're
did.
gone.
Right.
You're out of here. If I was to look at my riders, again, folks, if you want to see a copy of this benefit comparison, just send that to me in the comments. I'll shoot this right to you. What would you say are the 2 biggest sellers for the riders to add on extra stuff? You're adding on extra premium, but you're going to get some stuff out of it.
So I would say that the riders that we sell the most, and I'm telling you this up front, is definitely going to be the ambulance rider. It pays $250 for up to 4 calendar days per year. We do cap that at $2,500 on a lifetime, and the reason why is because we just want to make sure that the people that are getting a ride or the people that need a ride are getting a ride. If you fall down the stairs, you can call the neighbor and have them take you where you don't really need to call the ambulance. So
you don't want it abused.
Exactly, right. So we do cap that at $2,500, but the ambulance rider is the number one rider that we sell.
Okay.
Another one of the riders I think is really important to point out is the urgent care benefit rider. It pays $50 a day for up to 2 calendar days per year. 4 calendar days per year. And I think that's really important too, because you can go to the emergency room or you can go to the urgent care. So let's talk about your daughter just for a second. So I know that your daughter got hit yesterday, just rear-ended.
Yep.
It wasn't really an emergency room situation. Nope. You just wanted to go and make sure that she was okay, get her checked out by a physician. You took her to the urgent care. Smart move. It wasn't really an ER.
Did you hear that? She said smart move.
It wasn't really an emergency care situation.
You know how many people suggested that I go to the emergency room? At least 5. The police officer, wonderful man, and I don't blame people for this because they don't know our industry. He even suggested maybe an ambulance.
Oh my!
I was like, what in the world? Everybody said you could just go. Why don't you just go to the emergency room? My daughter finally is like, why aren't we going to the emergency room? I'm like, for the love of God, sweetheart, and then I go into my insurance soapbox and you're fine. I just want to have someone with the stethoscope, just make sure, look at your eyeballs.
Right. But they're still practitioners.
This isn't an emergency.
Exactly. Right.
The average cost to go to an emergency room, and this was at least 10 years ago when I was doing a lot of CE classes on health insurance, not ACA, back in the old days, was $500 to just sit in the waiting room. To just sit in the waiting room was $500.
That's crazy.
So yeah, it took me 3 tries to find an urgent care, which is kind of comical, but we did find one.
Right. They're usually less expensive. You get the exact same care, if not better care, because it's more personalized. They're less busy than an emergency room.
Right.
And what you were doing with your daughter was not an ER type situation. It was, let's just make sure that you're okay. Let's check you out. Let's go to the ER. You don't need to go to the ER for a flu. Right? You need to go to urgent care for the flu or a sinus infection. There's certain things like the blood clot that my next door neighbor had. She went to the urgent care first just to get it checked out to make sure. They then sent her to the emergency room. They told her that it was probably the best place for her to go. And then obviously she went on to the next stage, which was the under observation at the hospital. So I think the urgent care rider is really our number 2 rider. It's a newer rider for our hospital indemnity, but it is outstanding. It is outstanding. And as you know, Rebecca, in our area, urgent cares have popped up everywhere. That's nationwide.
I'm telling you, these hospital neighborhood little stores that are everywhere, they're going to rival CVS and Walgreens. You see, and I just chuckle, and I'm always teaching my kids about insurance and talking about, the stuff around us, and I'm always pointing out right now, because here in Noblesville, my God, you can't go a mile and a half and then there's a St. Vincent's clinic or a Riverview clinic or who are the other ones? Community or IU Health. It's big business. Someone's making some money.
Right, they are.
Are you guys doing much with the outpatient therapy chiropractor?
So the outpatient therapy and chiropractic rider is, to me, I think it's a gold mine for that, because actually the chiropractic services would really pay for the entire policy on its own. So for you agents that are out in podcast land, you definitely want to go out and have a rate run on this, because you're going to be pleasantly surprised how much the base benefit is priced, how it's priced, what it's priced for, but the riders are outstanding, and they're also priced to really sell. The outpatient therapy pays $50 a day for anywhere between 15 and 30 days. Those are pools. You either buy 15 or you buy 30. That covers physical therapy, occupational therapy, speech therapy. But the one thing that we added to that particular rider is the second part of that. That's the chiropractic rider. It pays $50 a day for 5 days per calendar year for manual adjustments or manipulations of the spine. Why is that important? Well, there's a lot of people that are there that look at OD type work that keeps them healthier.
What does OD mean?
It's so the doctor of orthopedic.
Okay.
The orthopedic. So you'll see like ophthalmologists.
Oh,
have
so
that.
OD is kind of like an MD,
Kinda
but it's
like-
an OD?
Right.
Well, heck, I didn't know that.
Yep. So that chiropractic writer, really, if someone went in 5 times a year, it could potentially pay them back for what the cost of the whole
Well,
policy keep in place.
I'm going to just chime in with my own personal experience. So I am officially finally going to a outpatient therapy. I'm going to a physical therapist.
Mm-hmm.
I've struggled for years with my back. And I love to work out, and I love, I'm trying to stay in shape and all this good stuff. And my back is always tight. I'm always in lower back pain.
Mm-hmm.
I do the chiropractor. I get massages. But it's just gotten to a point where my quality of life is really, it's always on my mind. I'm too young.
Yes, you are.
So I finally broke down because, of course, people had recommended physical therapy. I automatically thought it was going to be too expensive. So I just thought I could grind through it and blah, blah, blah. So I am now going to my physical therapist. Love her. Her name is Chris. She's teaching me stretches. Totally starting to work. I'm beyond happy. Man, oh man, to get $50 a day for so I don't think I'm going to need her that much. I figure probably 10 to 12 visits because I'm learning my stretches and she's able to push things back and this and that. So this is amazing.
Yeah, you could go a little over once a month just to be able to go see her and still get paid back if you had the hospital.
And get paid, and then the chiropractic, more people are using chiropractic care, massage care for overall well-being.
Yes.
So yeah, I get all types of excited about that. So would you say that those are your top 3: ambulance, urgent care, outpatient, chiropractic?
Yes. Another big seller is our skilled nursing facility because that gives someone the opportunity, let's say an older client, that might be a writer an agent would want to consider. And the reason why is because if you have, let's say a stroke victim goes to the hospital. So they're at home, they have a stroke, they use the ambulance, they go to the hospital. They get inpatient care while they're recovering from their stroke or during that time frame, the emergency side of the stroke. Typically, a stroke victim will then be released over to a skilled nursing care to be able to be rehabbed back. So that skilled nursing rider is very important. It pays anywhere between $100 to $200 a day for up to 50 days, 0 to 50 days. And that I think is really important for the rehabilitation side. Also, that particular rider, something that we haven't touched on yet, but this particular rider has a one-time restoration of benefit. So let's say that same stroke victim stays out of skilled nursing care for 180 days or longer. We're going to restore that rider one time. Now, talking about restoration, remember that base benefit with all of its robustness that we were talking about earlier?
Yes.
The entire base benefit has a restoration to it. For every 60 days a client stays out of the hospital or away from observation, we will restore the base benefit indefinitely. As long as the premiums are paid, we're going to continue to restore it. Why is that important? Because there are people that will use this product over and over and over again for the lifetime that they hold the product that needs to have that 6 days or that 21 days, whatever they choose for their inpatient care and also their observation to be restored. I don't know about you, but I look at it as I get older, the likelihood of me going to the hospital between the ages of 40 and 85 or even 40 up until death, I hope I live longer than 85, is going to be more than one time. It's going to be more than probably 10 times for whatever the case may be.
Are you guys thinking in terms of adjusting these rates, an annual rate adjustment? You're just going to see how the block performs? What do you think?
Once the policy is paid, the premiums stay the same. So once you start to pay the premiums, the app is taken, the policy is taken, the rates stay
Forever and ever and ever?
forever, never.
And ever?
And ever.
So I'm 47.
Yep,
Will be 48.
correct. I think so, as long as you have another birthday.
I should.
Right.
July 30th, if anybody wants to send me a card or money or diamonds. So this will be cheaper for me because I'm younger.
Right.
I buy this, I keep this until I cancel it at the same premium.
Yes.
You know what? That makes me want to find another sound.
Can you do one that's like a hee-haw or something?
Well, I gotta, I'm only so good with my gadgets. So what am I not asking? Wait, I hear something.
Excellent. Absolutely excellent.
That was nice.
I like that one. I like that one.
So let's recap. First off, folks, if you don't have this, you need to reach out to me. I'm not going to talk comp on a podcast. That would not be cool. And how many states is this product in?
Starting on February the 1st, it will be in 36 states.
36. 14
I believe-
unlucky states are not going to make the cut.
All right, I believe it's 36.
So, guys, you need to let me know what states you're in so I can get this benefit comparison to you. I'm going to tell you the hottest thing that I did not pick up on until just now, which is why you need to hear things multiple times, not just once, is that observation unit.
Mm-hmm.
That's what I like to call ridiculous.
It's ridiculous.
That's
yes.
pretty awesome.
100%.
So, oh, you know what? I was supposed to do a commercial. I got to do a commercial real fast. And thank one of my sponsors. So, I want to thank my sponsor, Anthem, Blue Cross Blue Shield. Anthem, located beautiful Indianapolis, Indiana. They've been a fantastic partner of Gordon Marketing for over the years, offering Medicare Advantage plans as well as MedSup. And I will say that their MedSup rates have become quite hot. So, good for them.
Yeah.
Everybody wants that older market. Everybody likes the olders. The wisers. Kelly should stop smoking. So,
I'm not a smoker.
if you're not currently working with Anthem and you live in one of their 14 states, please reach out to me so you too can experience the wonderful world of Anthem. Okay, that was my commercial.
Very nice.
Is that nice?
That was very nice.
That's nice. They're going to owe me some money for that little blurb.
Oh.
I always send my bills to sponsors after they sponsored, although they don't realize they have been my sponsor.
Oh.
So.
Okay, well, look for my invoice.
Oh, shoot. Yeah. Shoot. Yeah. Look, folks, I want to take your comments, your questions, your concerns. We will be doing webinars on this. This caught my attention. Absolutely caught my attention. You can do, this is like silly putty. You can do a lot of things with this plan. Mm-hmm. So, Kelly, is there anything that I have missed?
No, I don't think so. I want to thank you, first of all, for letting me come in and do this with you. I think it's I think this is a great opportunity. And Medico obviously has a wonderful product suite. This is not the only product that we carry, but this right here is the holy grail of product.
So, Kelly, I am thinking we need to have a fast start incentive for new producers who have never used this. They write so many apps, they get something. Are you down with that? I mean,
am.
we can take out our piece of paper and our pencils and craft something.
Sure.
I, of course, have some ideas already, but folks, you're going to want this, so reach out. So look, I want to thank Kelly Rayburn with Medico for being our wonderful guest on the show. And this is Rebecca Gordon with Insurance Now with Rebecca Gordon telling you, have a great day. Do something nice for someone. And if you see trash outside, lead by example and pick up one piece. I actually try to do that. And then carry hand sanitizer. But other than that, those are my wise words. If you guys have never checked us out, Gordon Marketing, you can check out our blog, our website, our YouTube channel. We've been doing this for over 40 years. It's hard to believe, but we love what we do, and we hope that it shows. I'll talk to you guys soon. Thanks for the business. Thanks for listening. Talk to you later.